This is a short film with important information about your anticoagulation treatment. After the film, if you require any further information, please ask your doctor, pharmacist or nurse. Why do I need an anticoagulant? Anticoagulants are medicines that work by extending the length of time it takes for your blood to clot, making it less likely that blood clots will form in your body or stick together. People need anticoagulants for different reasons. Some may have had a blood clot in their leg, called a deep vein thrombosis, DVT, or a blood clot in their lungs, known as a pulmonary embolism, a PE. Other people need anticoagulants because they are at risk of developing a blood clot. For example, those who have an irregular heartbeat, such as atrial fibrillation. Atrial fibrillation is a type of abnormal heart rhythm and increases the risk of a stroke. Some of the main oral anticoagulants prescribed in the UK are apixaban, dabigatran, edoxaban and rivaroxaban. Your clinician will discuss the options for anticoagulation with you. The anticoagulants work by blocking blood clotting factors, which makes it harder for your blood to clot. The length of time you will need anticoagulation depends on the reasons for your treatment. Some people need it to be for a few weeks or months, others need it to be long term. Your clinician will advise you on how long your treatment will be for.
In terms of reassurance, I can promise you that there is no one out there who can worry more than me. So when I first started, I was in serious panic mode. But having gone through the whole process, don't worry. Put your trust in the Anticoag team. They're absolutely brilliant and very supportive.
How to take direct oral anticoagulants. Some anticoagulants are called DOACs, direct oral anticoagulants. These include rivaroxaban, dabigatran, apixaban, and edoxaban. Always check the label on your medications for directions on how and when and how you should take it. You should take this medication at about the same time every day with a glass of water. Rivaroxaban tablets must be taken with food. This should be with a meal to make sure the full dose is absorbed. Edoxaban and apixaban tablets can be taken with or without food. Dabigatran capsules can be taken with or without food, and the capsules need to be swallowed whole. Do not open the capsules, as this can increase the risk of bleeding. The clinic nurse, pharmacist or GP will advise you on how to take your anticoagulant. The clinic, hospital or GP will give you your first prescription. You will then be able to order your medications in the usual way. It is important that you do not run out of your anticoagulant tablets. You should ensure that your anticoagulant medication is always stored safely away from children and vulnerable people. Do not stop taking your anticoagulants without seeing your doctor first, as you will put yourself at risk of serious medical conditions. If you have any questions, please ask the clinic doctor, nurse or pharmacist. If you forget to take a dose, you can take it as soon as you remember, as long as you do not exceed your daily dose. However, if you have been started on dabigatran, you can take a dose as soon as you remember, provided you leave at least 6 hours between doses. If you find it hard taking your medicines regularly, speak to your pharmacist, nurse or doctor. What if I take too much? Taking too much anticoagulant increases your risk of bleeding. You must contact your doctor or NHS 111 if you think you have taken too much anticoagulant. If you need to go to hospital, take the packet or leaflet with you, plus any remaining medicine. Will I be given any information, leaflets, alert cards? When you collect your anticoagulant medicine, it should come with an alert card. It is important to remove the card from the pack and keep it with you at all times. This will alert anyone in an emergency that you are a patient receiving an anticoagulant. You must write your name, address, GP details and telephone number on the alert card. It is important these details are up to date and that you inform your GP or clinic of any changes so that your records are always up to date. If there is no alert card, please contact the pharmacy or clinic where you collected the medicine from. Do I need a blood test? You will need to have blood tests when you take the direct oral anticoagulants. These tests are there to make sure that the medicine is safe for you to take. These tests will be before you take the medicine and then every 12 months. In some patients, this may need to be every 3 to 6 months. Different factors, including age, weight, and how your kidneys work, will determine how often your blood is needed. Your GP will give you further information on the frequency of testing that is required for you.
They do like to do regular blood tests just to check, your kidney function and, check everything anyway, but your GP, I think I have that yearly, so it's no bother at all.
Are there any side effects? Like all medicines, there is a risk of experiencing side effects while taking anticoagulants. The main side effect is that you can bleed too easily, which can cause problems. Having a bleed is not always obvious. You may experience less serious bleeding. This kind of bleeding includes bleeding for a little longer than usual if you cut yourself, occasional nosebleeds that last for less than 10 minutes, bleeds from your gums when you brush your teeth, bruises that come up more easily and take longer to fade than usual. This type of bleeding is not dangerous and should stop by itself. If it happens, keep taking your anticoagulant, but tell your doctor if the bleeding bothers you or it does not stop. However, anticoagulants can cause serious bleeding. If you get any signs or symptoms of serious bleeding, stop taking your anticoagulant and call your doctor, anticoagulant clinic or ambulance, or go to A&E. The signs and symptoms of serious bleeding include blood in your urine, black poo, large bruises or bruises that happen for no reason, nosebleeds that last for longer than 10 minutes, blood in your vomit or if you are coughing up blood, severe headaches or a headache that is not normal for you, fits, seizures, changes to your eyesight, numbness or tingling in your arms or legs, or feeling very tired, weak or sick. These can be signs of a bleed in your brain. Any bleeding from a cut or injury that will not stop or slow down. Seek urgent medical advice if you become breathless, weak, tired, pale, dizzy, have chest pain, as these may be a less obvious sign of bleeding. Urgent medical advice should always be sought in the case of accidents, traumas, blows to the head or any bleeding which will not stop. Some anticoagulants cause dizziness and fainting. You should not drive or operate machines if you are affected in this way. You will be given medical contact telephone numbers during your anticoagulant appointment.
It's not as scary as it sounds. You think you're taking this pill that's going to cause all these massive bleeds and humongous bruises and everything like that, and actually it's just there to, save your life, really.
I can't say I've had any side effects whatsoever. I know there's certain things you should avoid, but I can't say that I get any side effects. I just carry on life as normal.
At the beginning, I was a little bit tired on occasion, a little bit of bruising. In terms of dealing with the side effects, I did contact my GP and the anticoag unit. They just said that it was extremely normal what I was going through. They were always there for me and stop worrying.
What about my other medication? Other medicines can change the way an anticoagulant works, both prescribed medicines and things you buy, such as some herbal medicines and painkillers. It is important that the clinician knows all the medicines that you normally take. Whenever any changes occur to your usual medication, always let whoever is making the change know that you take an anticoagulant. Types of medicines that can affect anticoagulants include antibiotics, medicines for epilepsy, antifungals, antivirals, anti-inflammatories or herbal remedies. Please advise the clinician if you are allergic or intolerant to any medicines or foods. If you are purchasing medicines over the counter, whether at a pharmacy or supermarket, please get advice from your community pharmacist prior to starting.
I take a few other tablets, but I always think it's the most invasive of anything I take. It's caused me no problems at all, nothing whatsoever.
What about diet and alcohol? The types of food you eat do not affect direct anticoagulants. Do not exceed the national guidelines on taking alcohol. These are up to 2 units a day for men and women, which is a total of 14 units per week. An example of 2 units is either a standard glass of wine or a pint of lower strength beer. You can discuss this with your doctor, nurse or pharmacist, who can provide more details. Excessive amounts of alcohol are not advisable, as this may increase your risk of bruising or bleeding.
I haven't altered my diet or alcohol intake. I'm not a big drinker, just a social drinker. It wouldn't stop me going out, it wouldn't stop me having the odd tipple now and again.
What if I smoke? Smoking is associated with an increased risk of blood clotting, so it is advisable you try and stop smoking to reduce your risk. Please ask the clinic staff if you would like the contact details of a smoking cessation service to help you stop smoking. Otherwise, you can visit smokefree.gov for more information. Who else do I need to let know? If you intend to have any injections or procedures such as dental, surgical or cosmetic interventions, you must tell the doctor, dentist or nurse looking after you, or the professional who is going to perform the procedure, that you are taking anticoagulants. Show them your medical alert card, which comes with you within the packet. You may need special care and advice during these procedures, so please inform the GP or clinic staff in advance so that your care is safely coordinated. What about my lifestyle and travel plans? Taking anticoagulations does not affect your general lifestyle. It is good to remain active. You can take part in many sports while you're on anticoagulants, but contact sports such as rugby, football, hockey and horse riding are not advisable because of the types of injury it can cause. Additional dangerous activities such as skiing, mountaineering and surfing are also not advisable. You will still be able to travel and go abroad whilst on anticoagulants. Always ensure that you have adequate supply of tablets before you travel and adequate travel insurance. We advise that on a long distance journey, you take regular breaks to exercise your legs. The only time it would not be advisable to fly is within the first few weeks of developing a new blood clot. Please inform the clinician if you have any flights or travel booked within the next few weeks.
It's just about being sensible really, always making sure whatever your doses that you've got for the week that you've got them on you. I always carry it anyway, just in case I am caught anywhere.
The tablets that I take are always set up at the side of my breakfast tray every night, ready for the following morning. The only time there was a problem was when I was travelling and going through various time zones. So then I put a reminder alarm on my mobile phone.
Advice during pregnancy and conception. It is not known if anticoagulants affect the baby during pregnancy. If pregnancy is possible, a reliable contraceptive should be used. You may need to discuss this with your doctor. You should also discuss plans for future pregnancy with your doctor before trying for a baby. If you think you are pregnant whilst taking an oral anticoagulant, you should get a pregnancy test as soon as possible. If this is positive, get an urgent appointment with your GP or contact a hospital early pregnancy assessment unit. Also ask your doctor or pharmacist for advice before breastfeeding on anticoagulants. Living with anticoagulation is nothing to be afraid of.
My advice for someone just starting on anticoagulants is don't worry. And I think as well, get a pill reminder app of some variety or whatever helps you remember to take them, because it is quite important that you take it every day.
Thank you for watching this film. We hope you have found the information helpful. If you wish to discuss anything or require further information, then please approach one of the anticoagulation clinicians who will be happy to help.